Alright, so those are the three types of hormones that are secreted within the thyroid gland. Talking a little bit about some of the disorders that we're going to find with this. Again, I mentioned goiter due to a lack of iodine within their diet. Now, basically, goiter really is just an enlargement of the thyroid gland, and they have different types. So you have like simple adenomatous or nodular goiter. So some of them are one big lump, some of them are irregular and bumpy and weird. Um, yeah, it all kind of depends on if it's hypothyroidism or hyperthyroidism. Now, hypothyroidism, again, hypo means under, right? So hypothyroidism is when the thyroid's not working the way it should and it's producing less than it's supposed to. There's basically two ways that they categorize hypothyroidism, and it all depends on the age in which it's being affected. You have infantile hypothyroidism, and that's going to be a failure of the thyroid gland to form during fetal development, where that means that they're gonna have a lack of the hormones that regulate metabolic processes. So the cells are not going to work the way that they're supposed to, nor are they going to reproduce the way that they're supposed to. So that's going to mean that they're not going to grow as high. They're not going to be using the nutrients that you're coming in from your diet the way that they should, because the cells are not working the way that they're supposed to. So while they are intaking enough, they are still actually malnourished in that the body won't absorb the nutrients the way it needs to. Anyway, evidently by state law, all infants are now being tested for hypothyroidism in the U.S. Kind of interesting. I didn't know that. Okay, so the other type is myxedema, and that's thyroid atrophy in an adult. Again, it means that the thyroid was working properly when they were younger, but as you grow older, it just sort of like started to deteriorate, and now it doesn't produce as much as it should. Some signs of this are going to be lack of energy, sluggishness. They can become cold. Their hair becomes dry and skin becomes dry and waxy. Tissues of the face swell. Doesn't that sound delightful? I usually just associate with the fact that I'm eating too much sugar. And then, yeah, so those are going to be some of the different ways. They can also gain weight or lose weight a lot. Nice thing is that this one can be administered orally, so you can just take a pill and you're good. Although the pill is not going to fix the thyroid, so you're going to have to take it your whole life. And let's be honest, them getting the levels correctly of the amount is always an issue. My mom has hypothyroidism, and so she started taking medication, and it took her months for them to figure out the proper amount in which she should be getting. So it's definitely a work in progress that you have to kind of figure out. All right. So hyperthyroidism is going to be an overactivity. That means that the cells are actually going to be producing too much, or they're consuming too much of the nutrients, and so you're kind of starving in a way. Okay. One of the most common forms of hyperthyroidism is Graves' disease, and you can see an illustration of Graves' disease on page 266. And it's quite the picture, isn't it? So that's going to be accompanied again by a goiter, and then they're going to get an appearance that they're going to get the protuberant eyes, so their eyes are going to go buggy, and They're going to have strained appearance, is what they say, intense nervousness, weight loss, rapid pulse, sweating, tremors, and abnormally quick metabolism. Again, we're talking about our body's supposed to do things at a very specific rate, and when it starts doing it at a much faster rate than it's supposed to, where it's not going to function in a normal way in which we have full control over it. So that's why you're going to get a lot of this kind of rapid, nervous, too much energy kind of thing. So, treatment for that is going to be a suppression of the hormone production, destruction of the thyroid tissue. Ooh. So you can take a type of chemical that's going to just suppress the hormone and say like, ooh, you need to stop. Or you can get the thyroid tissue destroyed a little bit, or you can surgically remove part of it. Doesn't it sound delightful? Again, when we talk about the pituitary gland having the thyroid stimulating hormone or thyrotropin, it's kind of interesting to note that they don't really address that one, except for the one where it's saying suppression of hormone production. So it's not really suppressing the thyroid stimulating hormone. It's just suppressing the gland itself so it won't respond to it and produce as much. It's kind of interesting. Okay, so that's a lot with the thyroid. Let's see if I can see anything else into my book. No, that's pretty much it. So that's going to be with the thyroid gland. Oh, just in terms of its shape, you have kind of like two little bumpy lobe thingies, and then it comes up and connects together in just this little line kind of thing. And that part that connects them is called an isthmus. Just like an isthmus in geography is a very thin band of land that connects two larger bodies of land. It's kind of the same idea here, where it's just kind of bridging between two larger bodies of the thyroid. Okay. So after the thyroid, we're going to talk about the parathyroid glands. So thyroid glands, again, are just kind of in the front. I can stimulate it like that. Parathyroid is in the back. And you can see a great picture of that again on page 266. In that it's kind of off to the side. So the thyroid itself is right in the front. The para is actually like much deeper in there. Much deeper. Anyway, so there's parathyroid. These guys are little. They're basically 4 lobes, so 2 on each side. And they're behind the thyroid gland, which is why they're called para. Para sort of means behind or around. So the parathyroid releases really just one hormone, and that hormone is known as the parathyroid hormone. So parathyroid gland secretes the parathyroid hormone. This one is actually going to promote the calcium release from bone tissue. So these guys are actually going to be stimulating the osteoclasts to break calcium off of the bone matrix. Okay. Now, it also causes the kidney to conserve calcium. Now, if you guys remember, calcium is necessary in order for the sarcomeres to slide because of the actin and myosin. So that's where the actin is the one that's in the middle, so not the one with the little hairy thingies, but the ones that are in the middle. And actin is actually comprised of 2 different types of molecules, and one molecule will actually bind with the myosin, so the little fibers will actually grasp it and hold on. But the other type actually blocks it, so the myosin doesn't work at all and connect with it. So the calcium, when it comes in, will actually grasp onto some of the actin that's blocking the myosin. So the calcium grabs it, kind of gets it out of the way, so then the myosin will hook in and like pull onto the sarcomere sliding gate. Okay. So so calcium's necessary. It's not just about our bones, it's actually about muscle contraction. It's just pretty important. So if we find that our levels of calcium become low within the bloodstream, the parathyroid gland will then be stimulated to release some parathyroid hormone. Okay. And one of the things that when you get a removal of the parathyroids, it actually can stimulate muscle spasms, which makes sense. Essentially, it's a dysfunction of the muscles, and so you're going to get spasming with it. All right, so that is pretty much what you're going to be dealing with the parathyroid gland. Now, the next glands that they have us talking about are the adrenal glands, and those ones are really complicated. So I'm going to go ahead and break this video, and we'll go on to the adrenal glands in the next one. Thanks.